Hello, this is Dr. Gabe from First Look MRI, and this is a 29-year-old female with complaints of a palpable mass along the palmar radial wrist. The doctor thought it was compatible with a ganglion cyst and wanted to make sure before surgery, and indeed she does have this lobulated fluid signal intensity structure along the palmar. This is the palmar surface. This is the radial side. There's a marker placed over this, so it does correspond to the site of clinical concern. We see the ganglion cyst over here is multiseptated. This is a fairly common finding, and when they're this big, the surgeon will usually go in there and remove that, and that's the plan. The patient also had a couple other things besides this ganglion cyst. We can see over here the base of the thumb. Here's the thumb. This is the first metacarpal bone. It's really short, and the fourth one maybe a little bit short. I'm sorry, the fifth one here maybe a little bit short, and the fourth one here maybe a little bit short. So the fourth, fifth, and then mostly the first metacarpal, which is very, very short. So this is something that is a benign congenital, or I'm sorry, developmental abnormality, usually a chromosomal abnormality. You can also see with some other things like Turner syndrome, and this is just an incidental finding here, easily found on x-rays or just on clinical examination. So just an incidental aside, but she also had another finding over here along the ulnar aspect. This is the radius, this is the ulna. We see the triangular fibrocartilage, which is like a little meniscus here, a little shock absorber between the ulna and these carpal bones. And it looks pretty good here. But if we go on dorsal images, things look good. If we go towards the palmar aspect, we see this bright signal here we need to investigate. So we're going to go to the axial images, go down to that, and when we get to this image, we see the radius, ulna, and we see this bright area right here. So this is right where the palmar radioulnar ligament would attach. So the radioulnar ligament comes off here. It's usually very hard to see, but in this case we don't see any clearly defined band going across here. So it looks like the palmar radioulnar ligament is torn in the adjacent joint capsule, and that is allowing for this fluid to weep out of the joint and track down here adjacent to the distal ulna here. So a tear of the palmar radioulnar ligament. The other thing we notice is this is the extensor carpi ulnaris tendon, the ECU. Normally it will sit in a little groove here, and it'll cross over the distal ulna in the little pivot or divot here, and this one is slipped backwards. It's hanging over here behind the ulnar styloids. This is subluxed posteriorly, and so they may have an injury of this thing called the extensor carpi ulnaris tendon sheath. It's part of the TFCC complex, and it covers this, helps hold this in place. So this is slipped backwards here. So they've had a probable injury out here with a tear of that palmar radioulnar ligament. I don't see a dorsal radioulnar ligament tear definitely, but sometimes you can have a small tear and it's thinned and maybe difficult to evaluate or visualize. And again, we have this posterior subluxation of the ECU tendon. It's intact, but just more posterior than we'd expect. So they may have clinical symptoms of instability or slippage of that. And so we'll report that and see what the surgeon thinks. But that's it. So main finding is just a prominent ganglion cyst right where the physician thought it should be. This is the abductor pollicis and extensor pollicis brevis tendons right kind of combined together to a glob here. This is the flexor carpi radialis tendon here. There's a ganglion cyst in between. And that's it. Thank you very much.